So Botox is an excellent neuromodulator. It weakens muscle and it softens the appearance of forehead lines, glabella lines, and crow's feet. And Cheryl's had some Botox recently and she looks excellent. It was first discovered when people, ocular plastic surgeons, were treating blepharospasm, and they were finding their patients were having this wonderful, relaxed look after their treatments, and that's how it was first used, and now it's the #1 procedure that's done across the country. Zeman is another example of a botulinum toxin. It's similar to Botox. It's like, I tell patients, like Coke and Pepsi. Cheryl, what do you think?
Oh, definitely Coke and Pepsi. Good word for it. Definitely.
Some people say there's a little bit of a difference. There's no scientific validation of that. Personally, I use both products, and there's a third product called Dysport, which is also very good. Again, safe, effective, no downtime, and it's the #1 procedure done in plastic surgery. Next is Restylane. Restylane is a relatively poorly cross-linked but very effective hyaluronic acid. Hyaluronic acid is the stuff that's between our cells. It's the stuff that keeps our skin soft and moist and youthful. Cheryl, what do you think of just in general hyaluronic acids? Or, you know,
I love hyaluronic acids. I like a soft fill. I've never needed anything to be very, very supportive. I like the fact that if there's a little something you don't like, there's a way you can dissolve it. It can be corrected. So hyaluronics were always my choice.
Several hyaluronics on the market. Restylane was actually the first and probably the oldest. Juvederm is the most popular, I would say. And then there's some really unique specialized hyaluronic acids. This is one of them. It's called Belotero. It's excellent for fine lines around the mouth. And it's also hyaluronic acid, but it's really designed for a specialized area, which is fine lines. The Juvederm is for deeper lines, and then we have another one called Voluma, which is also made by Allergan. It's kind of the cousin of Juvederm. Voluma is a very substantial hyaluronic acid. It's really the 2-year filler is what they call it. It volumizes cheeks. It will stay for a long time wherever you're placing it. It comes at a slightly increased premium cost, but it's a very nice filler to use and lasts a long time.
You're giving it 2 years instead of 1 year, so
right.
The price is really less if you bought 2 individuals.
Right. And you know, most of these fillers are mixed with lidocaine. In other words, when you inject them, you should feel some numbness. It's not a very painful procedure at all. It's actually a very easily tolerated procedure, all these injectables. We're now looking at something that's not actually a hyaluronic acid or a filler. This is something called Kybella. Kybella is a deoxycholic acid. Just to put that in regular words, it's it melts fat, and this is the this is the holy grail, an injection that melts fat. It is very effective for submental fullness and around the jowls. In other words, just under your chin, the fullness under the chin and the jowl area. It's also being used in the axilla, like lateral breast fat. It's been tried in other areas, but not as effective. It's also made by Allergan, and it is a very unique product. And you know, we like to use it again for submental fullness. I'm going to go down now to Radiesse. Radiesse is my go-to filler for volumizing cheeks, nasolabial folds, and the reason is I see that it gives the most projection or G prime. In other words, it stretches the skin more than any of the other injectables. It lasts about a year, and it has a very good safety profile. And Cheryl, I know you see me inject a lot of the stuff.
Oh my goodness, that's definitely our go-to. It's just good for so many people. It really does lift those cheeks and fills in the volume beautifully. Just very natural. Everything is about natural.
It's very important, natural, correct. And you know, I talk about you know, it's like a facelift in a syringe.
Right.
2 of these will do like a mini facelift, give you a mini facelift. People do call it the liquid lift, or the lunchtime lift. This is the lunchtime lift that I'm holding right here, or a combination of several of these. So the next one that I will talk about is Volbella. It's a lip injector, and it's very good for, again, fine lines around the mouth. It is one of the softer hyaluronic acids. It is in the family of products of Juvederm, and it's very effective, and we will be using some of this later on this month in our event. Anyway, that's it for injectables for now. Again, welcome to Athena Plastic Surgery, and looking forward to seeing you next week.
Bye-bye.